So binder therapy is something that we use to help patients control their phosphorus. We utilize different types of binders, and these binders, what they do is they act like magnets and they absorb the phosphorus in the stomach while it's being digested. And so once that is absorbed, we're able to eliminate the phosphorus from that person's diet.
If you're currently on a medication that requires you to take 3 or more pills with every meal, and your phosphorus is still too high even though you've changed your diet, you might want to talk to your physician about changing to a different binder.
If you struggle with taking your current binder, don't feel bad.
If you can't manage to take all your pills every day as prescribed, you might not be taking enough medicine to keep your phosphorus down to the right level.
Velphoro is a phosphate binder that binds the most phosphorus per tablet. Because of this, you would only be required to take 1 tablet per meal.
With Velphoro, you start with 1 tablet with your breakfast, 1 with your lunch, and 1 with your dinner.
Velphoro can be taken in a number of different ways to help keep your phosphorus levels down.
Velphoro is flexible because you can break it into pieces and take it, you can crush it, or if you wanted to, you could chew it. And we all know the best binder is the binder that the patients are going to take.
Ask your doctor about Velphoro.
Indication: Velphoro, sucroferric oxyhydroxide, is a phosphate binder indicated for the control of serum phosphorus levels in adult and pediatric patients 9 years of age and older with chronic kidney disease on dialysis. Important safety information: Velphoro chewable tablets must be taken with meals. Velphoro should be chewed or crushed. Do not swallow whole. Tell your healthcare provider about all the medicines you take, including prescription and non-prescription medicines, vitamins, and other supplements. Velphoro can interact with other medicines. Tell your healthcare provider if you have any of the following: peritonitis and infection during peritoneal dialysis, significant gastric or liver disorder, recent major gastrointestinal GI surgery, a history of hemochromatosis or other disease that results in iron buildup in the body. People with these conditions were not included in clinical studies with Velphoro, and your healthcare provider will monitor your iron levels while you are taking Velphoro. Velphoro can cause side effects. The most common side effects are discolored stool, diarrhea, and nausea. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Discolored black stool is considered normal if you are taking an oral medication that contains iron, like Velphoro. Discolored stool may mask gastrointestinal bleeding, which was not a side effect of Velphoro in clinical studies. Before taking Velphoro, tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. Velphoro is available by prescription only. For additional safety information, please see full prescribing information at velphoro.com. To report suspected adverse reactions, contact Fresenius Medical Care Customer Service at 1-800-323-5188 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.